Beauty. This is Sandra, who's a 70-year-old lady, which, like me, you'll find difficult to believe. But Sandra's been coming to us for a number of years, yeah?
Yeah.
And has tried a number of treatments. So we're just going to talk about Sandra's history of what she's had done and how it's helped her. So first of all, you've had facial Botox, haven't you, Sandra?
Yeah, that's right.
And what benefits do you think you've had from that?
Well, the obvious benefits of the lines. I no longer look the cross mummy look. But the big benefit for me is the fact that I used to get some cracking headaches. And since I've been having Botox, it's very, very rare if I get a headache. And then it's only a slight one.
Right, so that's a secondary benefit of
Yeah.
Botox.
Yeah.
Botox is, of course, used for migraine on its own, but conveniently, the pattern of injections for migraine includes the pattern that is used for cosmetic improvement, so you get both benefits from it.
Right?
And then later on you had a Radiesse V-lift, didn't you? Which we
Yes.
put on both
Yeah.
sides because, if I remember rightly, you thought you were a little bit jowly, dare I say?
Yeah.
How did you feel that went?
I felt that went very well actually. It lifted it so that I no longer look miserable. Because, you know, I've got lines. The only way I would ever get rid of all the lines is surgery, which I don't want to go down that line. But the Radiesse, it lifts that I no longer have that miserable look.
Yeah, and when you had the Radiesse, I think last time we did it with the cannula. How was it in terms of pain or discomfort, the procedure?
I preferred the cannula
Yeah.
rather than quite a few injections.
Yeah.
With the cannula, it was really just a sensation of pressure rather than injections, but on the pain level of 1 to 10, when 10 is the worst, I would say it's about 2.
Yeah, the cannula is more. The other advantage of the cannula is there's less chance of bruising. With it not being sharp, you can't cut any blood vessels in the process. The other thing, finally, that we've done, and we're going to do again today, of course, is the lip filler. Now, what was going wrong with your lips that made you want that?
Just looked a bit thin, and particularly down at the corners where it folds in. I didn't want the Katie Price effect. I didn't want the trout pan. I just wanted that little bit of more fullness to just lift it.
Yeah, it's quite common that the outer part of the lips, probably the outer centimetre, tends to turn inwards and therefore look thin from this view that I and the camera are looking at now. And also for some loss of the Cupid's bow because it flattens. So in the procedure we're going to do today, which is going to be a lip filler, I'm going to increase the volume of the outer parts of the upper lip, so that will look more how it was probably 20 years ago, and reshape the Cupid's bow so that you get the 2 little ridges back under the nose, and it'll look subtly better. But of course, as you know, I don't do huge changes in one go because people tend to look, don't they? Do you find that people notice, or do they not know what's been done?
All the comments I get is the obvious one that they can't believe I'm 70, but that fact that I always look so well.
Do they not know why though? Can they
Well,
point at anything?
I will be honest.
Yeah.
You know, I'm honest of what I have done because there's no shame in it. But they always say, but you know, you always look so well. You don't look like you don't look like you've had anything done. Just look well.
Yeah. Yeah, that's great.
Which is what I want to achieve.
Well, that's what you wanted, isn't it? When we
Yeah.
first met, that's
Yeah.
what you asked
Yeah.
for. Brilliant. Sandra, thank you very much indeed.